Hi, my name is Shirley Morgan, and this is my remote collaboration and evidence-based care video for NUR FPX 4030. Interdisciplinary care is essential in healthcare as it allows professionals from multiple specialties to collaborate on a patient's treatment plan. Using our multidisciplinary approach allows for all aspects of the patient's needs to be met, improving outcomes. In this scenario, a 65-year-old male has recently been diagnosed with congestive heart failure. A remote interdisciplinary team has been initiated as the patient lives in a rural area. In this video, I will propose an evidence-based care plan that will improve the patient's outcomes, explain how an evidence-based plan helped develop my care plan and the usefulness of this research, and identify benefits and strategies to mitigate the challenges of interdisciplinary collaboration with a remote team. To begin, I will give a feedback of the patient and the interdisciplinary collaboration already involved. This is a 65-year-old male living in a rural community who has recently been diagnosed with congestive heart failure. This patient does not have access to specialized cardiac care, so the primary care doctor has established a remote interdisciplinary team involving a cardiologist, a pharmacist, and a nurse. The patient has begun experiencing symptoms of shortness of breath, fatigue, and lower extremity swelling. The patient requires a comprehensive treatment plan. Through a virtual meeting, the interdisciplinary team has established the beginning of a care plan for this patient. The cardiologist has recommended starting medication therapy to improve the patient's cardiac function and associated symptoms. The nurse is implementing a telemonitoring system to monitor the patient's vital signs and weight. The American College of Cardiology recommends a multidisciplinary approach for patients with congestive heart failure. The use of multidisciplinary approach decreases the risk of hospitalization for these patients. Sokos et al. 2023. When creating a multidisciplinary approach for the treatment plan of this patient, we must involve the patient during this virtual meetings with a primary care doctor, cardiologist, nurse, and pharmacist. Since the patient is living in a rural area with limited access to these providers, we must adequately educate the patient on their new medication, symptoms associated with heart failure, and when they should seek medical help. Congestive heart failure weakens the heart muscles and reduces circulation, and this can lead to kidney disease. Rowland, 2023. Because of this, our interdisciplinary team should consider adding a nephrologist to our team to monitor the patient's kidney function, as the patient will be on diuretics and fluid restrictions for the treatment of heart failure. With congestive heart failure, the patient is usually placed on a low-sodium diet, and adding a dietitian or a nutritionist that the patient can meet with to develop meal plans can increase the likelihood of the patient following this diet. Doing this can improve our patient's outcome and ensure that all needs are met for this patient. The evidence-based chronic care model allows us, as an interdisciplinary team, to use evidence-based research to manage this disease. The chronic care model uses a patient-centered disease management approach. This is a popular framework used in healthcare to improve the quality of care in patients with chronic conditions like congestive heart failure. Granutsky et al. 2023. The Stetler model of evidence-based practice is a framework that guides healthcare professionals in evaluating and applying research findings into clinical practice. The Stetler model shows how practitioners can use research as part of critical thinking. Stetler model of evidence-based practice, 2024. Using both the Stetler model of evidence-based practice to apply our research and the chronic care model will allow our interdisciplinary team to use evidence-based research in planning our care of this patient with congestive heart failure. While an interdisciplinary approach is essential in the care of this patient with congestive heart failure, it comes with challenges as we have to perform meetings virtually. This comes with issues of time restraints for every professional involved. We must create set meeting times that work with every professional involved in this care and the patient. As the patient's primary care doctor will be delivering most of the care for this patient, the patient needs to have regularly scheduled appointments with them to address any concerns or questions. The use of virtual meetings for this interdisciplinary team is a great way to involve all professionals in the care since the patient is in a rural area with otherwise limited access to this care. The use of remote collaboration within the interdisciplinary team is a great way to improve treatment in this patient recently diagnosed with congestive heart failure. I have created ways we can improve this patient's care plan, such as adding a dietitian and nephrologist to our interdisciplinary team and ensuring that the patient is receiving adequate education involving their treatment. Using the Stetler model of evidence-based practice and the chronic care model allows us to use evidence-based research and create care plans through this chronic condition. While using virtual meetings for the interdisciplinary team is hard, using the suggestions of creating a set meeting time allows us for all professionals to be able to meet and discuss the care of the patient. With the addition of this, we can improve patient safety and outcomes when creating care plans and treating this patient with congestive heart failure. Thank you.